Hi, my name is Dr Freda Khoo and I'm an ONG specialist. I've been practicing ONG for more than 15 years. My clinic is based in Thomson Medical Centre and I see pregnancies of all sorts as well as gynecological cases of all different types. So a caesarean section is a surgical procedure which involves putting the patient usually under half-body anesthesia. We make an incision at the lower abdomen, usually at the bikini line, and we open up the abdomen and we deliver the baby through the abdomen. For the recovery period, the skin usually heals very fast. So it usually would be healed within 7 to 10 days. However, because there is a cut and suturing within the tummy, it takes about 1 to 2 months for a patient to fully recover from the caesarean section. Different reasons why a patient would need a caesarean section would include if they had been advised for an elective caesarean section would be, for example, if the baby has not turned to a head-down position near term, or if the placenta is at the bottom, at the lower edge of the uterus, thereby blocking the passage of the baby out. Or if the mother has certain medical conditions which do not allow her to undergo the effort of pushing during normal labor, or sometimes if the baby has certain conditions which would deem the baby unsafe to undergo normal delivery. So a caesarean section is, after all, a surgery. So surgery would involve some risks sometimes. So the most common risk would be bleeding, infection. Sometimes some uncommon risks would be, sometimes as we are going in with a knife, there could be sometimes an accidental scratch on the superficial skin of the baby. Sometimes there could be things like injury to the surrounding organs like the bladder and the bowel. And more importantly, usually we say once a C-section, always a C-section, which means that usually if a mummy ends up in a C-section at the outset, more often than not, for subsequent pregnancies, they would need a caesarean section because there's already a scar at the uterus, and if we allow that scar to undergo contractions for the next pregnancy, there's a chance that the scar can break open. For some mummies, it is actually a personal decision. So the advantages of an elective C-section of the patient's personal choice would be, number one, it is controlled, it is predictable. You do not have to wonder when you're going to go into labor. The patient feels that she's in control of the situation. They do not need to endure the pain of labor and do not need to go through a long process of labor. However, the downside would be that if you undergo a caesarean section, you would have an abdominal scar, and the recovery usually tends to take slightly longer compared to a recovery for a normal delivery. And so initially there might be more pain, there might be more difficulty in moving around. Of course, there will be also some risks, as I have elaborated on earlier. So for mummies to be, if you're considering where to deliver, do consider Thomson Medical Centre, because we are in the business of creating wonderful experiences and memories for you and your family for your birthing experience. Our nurses are also very experienced, very caring. Our facilities are also well equipped to handle all sorts of situations. I'm Dr Freda Khoo and I'll be happy to journey with you.